By Adam Beam, Associated Press, Sacramento, Calif. California will soon pay the healthcare bills for low-income people 50 and older who are living in the country illegally, part of an expansion of Medicaid that aims to inch the nation's most populous state toward Democrats' goal of making sure everyone has health insurance. The new coverage will eventually cost taxpayers about $1.3 billion per year, money that's part of the new state operating budget that Governor Gavin Newsom and state legislative leaders unveiled Friday night. The budget is scheduled for a vote in the state legislature on Monday, with Newsom likely signing it into law before the state's fiscal year begins Thursday. California has spent a lot of money trying to make sure everyone has health insurance. The state spends millions every year helping people pay their monthly insurance premiums, the only state offering subsidies to families of 4 that earn up to $157,200 per year. California also taxes people who refuse to buy health insurance. Still, about 3.2 million people in the state are projected to not have health insurance next year, according to UC Berkeley Labor Center. Nearly half of those people are living in the country illegally, making them ineligible for full Medicaid benefits and other health insurance assistance programs. Advocates have pushed for years to make all low-income immigrants eligible for Medicaid. But the Newsom administration has balked at the cost, an estimated $2.4 billion per year according to one legislative analysis, opting instead for an incremental approach. Still, the inclusion of benefits for immigrants 50 and older was a victory for some healthcare advocates, whose efforts were stymied last year because of a projected budget deficit caused by the pandemic. "I gave my whole life to growing vegetables and fruits in the Coachella Valley. I am already old and I can no longer work in the fields. It is time for California to think about the health of people like me who have given everything, without receiving anything," said Josefa Barragán, a member of TODEC, an advocacy group providing services for immigrants in California's Inland Empire and Coachella Valley. The budget proposal also makes more older people eligible for Medicaid by eliminating the asset test. In general, low-income people are eligible for Medicaid. But for people 65 and older, it's not enough that they have low incomes. They must also not have assets that exceed $2,000 per month for individuals and $3,000 per month for couples. Assets exclude homes and second cars, but includes things like cash and checking and savings accounts and some jewelry, excluding wedding or engagement rings and heirlooms. Anthony Wright, executive director of Health Access California, called the asset test an antiquated policy that caused seniors and people with disabilities to lose their health coverage if they have any savings, even a modest amount for housing or an emergency.